Welcome to Doc Discussions with Dr. Jason Edwards, brought to you by St. Luke's, St. Louis.
Welcome to Doc Discussions. I'm Jason Edwards, and this is the world's best medical podcast, in my opinion. I'm here today with Dr. Devon Myers, and this is a little bit different than our prior podcast because this is actually the first time I'm meeting him. Devon, welcome to the podcast.
Thank you.
And so I like to start off with kind of figuring out like who you are and where you're from. So where do you come from?
So I actually grew up in Fenton, so I'm a local boy.
Very good.
Went to Rockwood Summit High School, did my undergrad, so I played baseball there. That's kind of my thing. And then went to Truman up in Kirksville.
Did you play baseball at Truman?
Played baseball there.
That's great.
Yeah, did my undergrad there in exercise science. And then went to, took a year off actually before I kind of decided I wanted to get into medicine a little late in the game at Truman, and then actually worked at MOBAP for a year as a patient care tech.
That's good. That's a great experience. And I think doing things like that and being an athlete too helps you become a better doctor.
Yeah. The experience at MOBAP was definitely, it was a good appreciation for what nurses and all the sort of support staff do. So it's a tough job. But after that, I went to med school, actually back to Kirksville, to KCOM up there, and then did my residency in Columbus, Ohio. So was up there for 5 years.
Very cool city.
Yeah, very much like St. Louis, kind of cliquey in terms of the areas and good sports town. So we enjoyed it there. And then I ended up back at WashU for my sports med fellowship. So it was good to be home last year and kind of transitioning into practice this year.
Yeah, very good. And so Truman's is it 1AA or Division II?
D2.
D2.
Yep.
And so, but that's pretty impressive to play NCAA sports. Very, it's kind of every kid out there, they're going to get a scholarship, and it's, the 1%, 2%. It's not a lot of people who end up doing
for
that.
Sure. It was a choice I made to go there versus somewhere bigger because I wanted to play and have that sort of, that collegiate experience, be more involved rather than kind of be in the background. So it worked out well for me.
For sure. Yeah. It's a lot about fit too.
Oh yeah.
And I think there's some advantages to being in Kirksville in general. There's not a ton of distractions.
That's true. There's more or less nothing to do.
And so, I'm sure you can get into trouble there, but as young kids do.
Yes.
But you're able to focus on your schoolwork, obviously, to get into medical school and also your craft. So did you get injured ever as a baseball player?
Nothing that needed surgery, actually. But plenty of injuries along the way. I was a catcher, so lots of little knee things and, injections here and there for the shoulder and whatnot. So
did you ever get injured to the extent that you had to sit out?
For a couple of summers, I had actually a low back issue that needed an injection, and so I ended up kind of burning a summer while I was in college, but nothing during the actual collegiate experience.
And that's when you put your whole, at that level, you put a lot of your life into it. I know, and it's incredibly depressing to put all this work in, and then all of a sudden you can't play. And I'm sure that was your experience.
I think that's a big component of what we do, in orthopedics, especially in sports medicine. Like, you have these athletes who are like training their whole lives for these big time events, or if it's a pro athlete, like this is their livelihood, right? So when they get hurt, it's it's not just a physical problem, it's a mental, psychological thing too. And so there's a big component of playing, not only doctor, but, sort of therapist too. And, especially if it's a big injury, somebody tears their ACL and they're, everybody knows what that means nowadays. Yeah. So they know they're done for a year more or less. And so that's pretty defeating.
And you think of, I can't remember what year it was. It was probably 2008 or something like that, or 2009. Tom Brady, first game of the season, gets tackled by the Chiefs player. I think he tore his ACL, right? Yeah. And it's like you think, well, he's Tom Brady, he's got everything. Well, man, that had to be an incredibly depressing year for somebody like that. And I think it lends some credibility if you've been there, as a doctor, to say, hey, I don't know exactly what you're going through, but I've been there, and I can we can get through this. Like, I've been down this road before. We'll get you.
Yeah, 100%. And having that, relatability, but also the experience of having worked with other, high level athletes in the past, I think also lends some credibility, because then you kind of know what their thought process should be and kind of who to connect them with to give them the best outcome, but also the best sort of path forward while they're recovering.
It's pretty rare as a college athlete and certainly a professional athlete to go through your career and not deal with injuries. It's kind of part of the deal.
Oh yeah, for sure.
I mean, you do have people like Michael Jordan who just like didn't have a ton of injuries, at least that you knew about. But I mean, there's these kind of legendary injuries. The Joe Theismann, 85, broken leg. Kevin Ware, 2013.
That was brutal.
Brutal.
Oh God.
One of the worst ever involved a hockey player from St. Louis in 1989, Clint Malarchuk.
Yeah, get sliced in the neck.
Yeah, and by the grace of God, one of the trainers was right there. And are you familiar with this?
Yeah, stuck his finger up the.
And he was a Vietnam combat medic.
Yeah.
As well as a trainer, and put his knee on his collarbone.
Yeah, it's wild.
And it's like. So we all have these visions. What are some of the bad injuries that you've seen, in the midst of play?
That's a good question.
Or actually, I mean, you probably, did you go, like during your training, did you go to sporting events?
Oh yeah.
Okay.
Yeah, especially last year during my fellowship at WashU, I cover a lot of different events.
You probably saw more actually like as an athlete than in that year.
I've had a couple of folks with, spinal cord type of injuries or neck injuries, that those are always scary.
Yeah.
More football than anything else is obviously what kind of lends itself to that. I'm trying to think of what else kind of saw last year.
There's a lot of non-dramatic
nothing
injuries.
Like super vicious. Like those are the things you have nightmares about.
Thank goodness, right?
They get their neck sliced or something. But yeah, that's part of the interesting part, I guess. I mean, it's interesting in kind of a weird, gruesome way. But it's like
it's just, advocate for it. But everybody finds it fascinating.
There's something unpredictable about it, right? That you have to kind of be. It's not like, especially in orthopedics, like if you're doing hip replacements or knee replacements, like there's nothing wrong with that. But that's kind of what you do, right? So it's one thing, and that's what you do, and you kind of know what to expect, what's coming next. But if you're covering a game, or even in our field where we're doing a lot of different stuff, it's not just kind of tailored towards one joint. It definitely keeps it more interesting. There's just a lot more at play, right? So you got to know how to manage head injuries. You got to know how to manage neck injuries. So I'm not a spine guy, but I know how to spine board and how to manage, people that are acutely injured at least.
Yeah.
So.
And you got to have I can tell you're a relaxed guy. And so you got to have a good way about you, kind of a steady hand on the till.
Sure.
In those moments, you need a cool head
for
sure.
Yeah, for sure. If something's, and the issue is a lot of times there's parents that get involved and they're down on the field, they're crying or yelling or whatever. And so it definitely makes it a little bit, it's a stressful moment for sure.
Yeah. And I'm sure, through your training and through mentors and stuff like that, and probably even just through your own personal experiences, you kind of learn how to take control of the situation
for sure
to get people to calm down.
Yeah. Definitely part of the training. So I had some really good mentors at WashU.
There's injuries that are like overuse injuries too, like stress fractures and things like that. Do you deal with that kind of stuff as well?
Yeah, to a certain extent. Kind of depends on what it is, obviously.
Yeah.
Some of those folks, we're oftentimes the first contact point for a lot of those people. Yeah. So like, the cross country runner who ends up with, a tibial stress fracture or, a femoral stress fracture, stuff like that.
Yeah.
It's more commonly lower extremity, obviously, since you're, more repetitively bearing weight through those areas. It can happen in the feet, fifth metatarsal, other places as well. So, we are often the first point of contact because, they have musculoskeletal pain.
Yeah.
Identifying them can be challenging though sometimes. You get x-rays and they can be fairly normal. Yeah. And you have to have enough suspicion to get an MRI. And that's where I think being a good doctor comes in because, you're kind of looking at the patient as a whole, right? Like if it's a young female, maybe they have some sort of the female athlete triad going on, or somebody who's postmenopausal. And, it's oftentimes more in females that we see it, or someone who's, even in guys who are like training for ultra marathons or crazy stuff like that.
I've had 5 stress fractures.
Have you?
And so I ran cross country at Mizzou.
Okay.
And 4 of them were in my tibia and 1 in my femur.
Oh, that's terrible.
And it's, after a while, you're like, well, it's right between the joint and like, right on the bone. And you kind of have a pretty good idea. But it did take them, they did like now this was over 20 years ago. So they did like nuclear medicine.
Yeah, like a true bone scan. Yeah. And you can still do those. So MRI will show it a little bit quicker a lot of times.
Is that right?
they're more sensitive now, but yeah, and then you got to look at like, do they need to go see somebody, from a rheumatologic standpoint, or like, not even that, but like somebody who can give them vitamin D or calcium, or like high doses of those things like that.
Because it could be for that. We don't want to talk about stress fractures the whole time, but for that specific injury, it could be an issue with the person.
Correct. Yeah.
For me, it was a volume issue. I was like running like over 100 miles a week, and so that'll kind of do it.
I don't think I ran 100 miles in the last 6 months.
Well, I promise you ran more than me in the last 6 months. But yeah, so trying to figure out like what the underlying cause is, whether it's internal or some sort of external locus of control.
Exactly.
And then and so do you deal with ligament injuries at all?
Yeah, that's one of my primary sort of focuses.
Is that right?
As a sports guy, so
so what kind of things is it with that? Is it like ACL?
ACLs, ligament wise, ACL is obviously the big one everybody thinks about. But in the knee, there's ACL, PCL, MCL, obviously the lateral, collateral as well. There's ligaments everywhere else too, in the ankle.
What about the elbow?
Not so much. Yeah, in the elbow as well. Tommy John ligament, the UCL.
Yeah.
Some kind of complex lateral elbow instability, with usually more associated with fractures. And then, the tendons are kind of the other half of our equation. So like the Achilles repairs and,
that's a tough one to come back from.
Yeah. Oh, it sucks. Yeah. And the rotator cuff tears, those sorts of things.
Yeah.
Not so much from a sports perspective. Those are usually more degenerative or traumatic in older folks, but it's all sort of falls under the same ballpark as something a sports guy does in terms of ligaments and tendons being one of our main kind of focuses.
And so there's everybody, the Tommy John things. It's a real popular subject matter because some pitchers have gotten the surgery and came back and been great.
Yeah.
And some people will even argue like it's like better to get the surgery, right? Like you've heard this, right?
Yeah. It's definitely a sort of a wise tale. I mean, there are some people who have had the surgery and they throw harder, but why is that? I mean, it could be that, their ligaments been stretched out for years from the sort of overuse of throwing.
Yeah.
And you get a fresh new ligament in there that heals nicely. You get a good surgery and now you have a tighter ligament there. And so you throw harder. It could be the months and months of rehab where you're focused specifically on your core and your chain and your shoulder and all that other stuff that you weren't doing before when you were just consistently throwing a baseball. So it's hard to pinpoint exactly why that is. I would say that that's not the majority of people.
Okay.
The majority of people do get back to play, but there is definitely a percentage of folks who don't. I don't have a number in front of me, but a percentage of folks who don't ever get back to the same level they were at.
Yeah.
And it's probably higher than most people would expect.
What, are people having this surgery at a younger age than they did previously?
That is true, for sure.
Why do you think that is?
I think a lot of it has to do with, the year-round sports craze and the sports kind of specialization.
Yeah.
It seems to be cooling off a little bit. When I was going through, playing in high school and college, it was like everybody was saying, you got to pick a sport, you got to play all year round.
Yeah.
And so I pretty much, from when I was like 10 or 11 on, I pretty much played baseball all year round.
Yeah.
And looking back on it, that was a horrible decision. I probably would have had fun playing football or hockey or any other sport, right? And but that was the best decision that myself and my family made at the time.
Sure.
And it was great. I was good at baseball. I enjoyed playing.
Yeah.
But I think from like you kind of develop one set of muscles, one set of movement patterns, whereas you're not, doing other sports. Maybe you're not throwing a ball. Maybe you're doing more running or kicking or, whatever that is. And you kind of strengthen muscles that you're not otherwise using.
So I'm going to get in hot water here.
That's a part of it.
I'm going to get in hot water on this one because most of the people I talk to about this tell me I'm wrong. But I'm going to stick with my position.
Let's hear it.
Doc Discussions with Dr. Jason Edwards. Brought to you by St. Luke's, St. Louis.
The pushing kids now we're getting off track, but that's okay. Pushing kids in a sport too hard, I think is too early is a bad idea. And I'll hear people say, well, you don't know, Jason, this is St. Louis. If they're not, at 9 years old doing this, they'll never make the varsity team. And like, obviously I was a Division I athlete.
Yeah.
And I've actually talked to, other college athletes about this, and they agree with me.
Yeah.
They say, yeah. And I could kind of tell that the way you're framing it. So in a high skill sport like golf or baseball, you probably need to start earlier to develop that skill. And things like football, which certainly has some skill to it, but is like less of a skill. I've seen people play their first year of college or of high school football as a senior and be all state.
Yeah.
I mean, so I think it's more important to have kind of to be a good athlete, to train, but to do many things. And I think that's better for you psychologically.
Oh, 100%.
And 100% selling out, in fourth grade for one sport.
Yeah.
Where you're not going pro.
Yeah.
Like it's not happening.
It's not a good idea. Like I said, I kind of did that and I regret it now.
Yeah.
Like at the time it seemed like the best choice, but, from an injury standpoint, luckily I never had anything terrible happen, but, I think it would have been better for my overall development physically.
Yeah.
I just think that from a psychological standpoint nowadays, like even when I was playing, like there was 2 good travel teams in St. Louis and that's what it was.
Yeah.
If you didn't play on one of them, you played on, some other sort of like semi-competitive travel team, but you maybe travel for a couple of weekends per summer kind of thing. It was pretty relaxed, right? That's not how it is anymore, right? It's like there's like 10 different travel teams. They all have like 8U through 18U.
Yeah.
You're shelling out thousands of dollars a month, to these organizations, and there's nothing wrong with them. I mean, their intentions are good, I think, to help kids learn, but it gets to be this like behemoth that they can't control.
And it kind of takes over the whole family.
It does,
and like to the people, if you're doing that out there, I don't know what's right. I'm just saying, but I have spent a lot of time in sports, and most of the people I know who have been collegiate sports, and I mean, I've trained with Olympians, high level guys.
Yeah.
Most of them as adults are not super pro that.
Yeah. And I don't think there's anything wrong with, if you're out there trying to, help your kid do what they want to do and they enjoy it and
if
they
the
love
kid
it.
loves it.
Yeah. Then that's great. I mean,
100% I'm behind it.
And, you got to do what you enjoy doing. Right.
Yeah.
But, I can tell you, like when I got to my last couple of years at college, I was pretty burnt out. And I feel bad about that now because I wish I could go back and play.
Yeah.
And it was, you look back and like, man, that should have been the time of my life, but I was kind of ready to be done.
So I mean, you play baseball, which is kind of a glory sport. Track is not a glory sport. I mean, there's not like, everybody's like, oh, you're on the track. No, that doesn't happen.
Yeah.
But I remember guys who I knew who, if I said their names, you would know who they are, who were on the basketball team and the football team who were, and I mean, you get, arena full of people cheering their name. Everybody on campus knows them. And I remember them were the same exact thing, junior year. They're like, I don't like this anymore.
Yeah.
This has turned into something that like, it's not fun. It's all work. And I'm not saying like, poor me, but it's being a college athlete. It's a tough life.
Yeah. It's a grind, you're trying to do school and that's, hard enough for most people. And then you're doing, and again, it's not like a feel bad for me kind of thing, but it's definitely like, a lot of people don't realize how challenging it is. Even at the D2 level, they're like, "Oh, you play D2." It's like,
but it's like Cody Schrader played D2, right?
Yeah.
So there's plenty of great athletes.
Yeah. So
actually, there's NAI guys who are incredible.
We used to joke because they're when I was there, they had this slogan. It was like, "We chose D2." Like, no, you didn't. D2 chose you.
Well, but for it's different. But I mean, for sure, like there's levels to it, but there can be some great individual athletes and teams.
Some great baseball players in the conference I was in that ended up playing pro. And so all joking aside.
Did you ever see the Appalachian State versus Michigan? When Michigan was ranked number 1, Appalachian State was like either the D2 or 1AA national champion of football. They played each other the first game of the season. Appalachian State beat them, the number 1 team in the country. So
yeah, they're good.
Yeah. So I mean, you can get some good athletes at all levels for sure. So do you see what's kind of like the demographic that you see in your practice? Is it younger, older, or kind of a little bit of everything?
I think it's a little bit of everything. It kind of depends on the variety of injury you're talking about. Like obviously your rotator cuff tears, your shoulder arthritis. I do shoulder replacements. So like those things are going to be in folks who are getting a little older, typically 50s to 80 kind of range. But up to whatever. But then mostly, the true sports injuries are going to be in younger folks who are doing those kinds of activities. So the ACL tears, the, true like meniscus tears, shoulder dislocations, AC joint sprains, those kinds of things are going to be usually in true athletes that are younger.
Yeah.
I say true athletes, that's probably not fair, but even your weekend warriors or people who are out kind of doing, stuff on the weekends. So, even like meniscus tears, though, for example, like we see meniscus tears in the 20-year-old football player, but we also see meniscus tears in, people in their 50s and 60s who have been grinding on their knee for a while and maybe have a twisting, pivoting injury, and now they have a meniscus tear. So how you treat them is sometimes a little bit different, but those are one of the ones where I kind of clump into like everyone can get it. Mm-hmm. But there are injuries typically more in younger folks, like the shoulder dislocations and AC joint sprains and things like that are more traumatic. Yeah. And I see some fractures and stuff too that are kind of all ages, but it's a mixed bucket for sure.
All right, so everybody knows like the newest hottest craze is pickleball, and I've heard from actually Dr. Ramos was talking to me about it, saying this is a new area where there's a ton of injuries, and for sure if you haven't been active and you're just getting into it, you're going to have some pain and aches, but it can get to a point where it's like outside of the realm of normal. Can you talk to me about just kind of differentiating like when people need to see you versus normal aches and pains, and then pickleball specifically?
Yeah. So the pickleball craze is definitely real. We see all kinds of pickleball injuries nowadays. And it varies from like your tennis elbow, which we see oftentimes in any kind of racket sport, versus like, trips and falls where we get hand fractures and wrist fractures and even like hip fractures, which is not ideal for someone who's out playing pickleball. But even then to knee injuries where you have exacerbation of knee arthritis, or meniscus tears, things of that sort. So the variety of the spectrum is huge just because of the way that you're playing. You're involving a lot of different things. In terms of, when to come see somebody, I think anytime you're noticing increased pain without significant swelling, without swelling inside the joint or in the soft tissues, where you can still weight bear, where things are managed with ice and anti-inflammatories, then that's kind of the place to start. So, using the ice consistently for a couple of days, taking reasonable doses of anti-inflammatories, obviously within the normal standards, 600 to 800 milligrams every 3 times a day. That's that kind of thing.
Yeah.
I see a lot of people who are like, oh, I took ibuprofen, but they took like 400 milligrams once a day, which is not going to really do much. So I do 600, three pills 3 times a day for 3 days. Yep. Usually it takes care of it. Yes, exactly.
And I'm 230. So, I mean,
if you do, exactly.
That'll work.
If you do a little run of that and you've iced it, you've kind of stayed off of it, modified your activities, and it's still not getting better, or you're noticing things like swelling, you felt a pop in your knee or your shoulder or something along those lines, you can't move your joint, you have inability to weight bear, those are all reasons to come see somebody much sooner, obviously. But, it's one of those things that's kind of intuitive to some degree.
Yeah, thankfully. Yeah, and for sure, there's going to be some aches and pains as you adapt. I mean, that comes with it. But I always tell my patients with cancer that, if you're having pain for more than 2 weeks and it seems like it's only getting worse,
for sure,
that's the time.
For sure, yeah. And persistence is definitely a sign. So, and in people who are playing pickleball, like you said, a lot of people are picking it up now who haven't been super active, and that's great. We want you to be active. And so ultimately it's a good thing, but you have to understand, like, when you're out there running back and forth, making quick pivoting, cutting movements, using a repetitive racket swing that you haven't done in maybe 10 or 20 years, it's probably going to be sore. And that can turn into tendonitis. It can turn into exacerbation of pre-existing arthritis, or, maybe you had a meniscus tear already that was asymptomatic that you've now aggravated. So those are kind of the tricky things where maybe you had a little bit of knee pain and you have arthritis and it just wasn't flared up, and now you have full-blown arthritis. And some people are confused about that.
Do you lift weights?
Mm-hmm.
So, you're familiar with the concept of progressive overload, right? Like over time, you slowly increase the volume or the weight or both.
Of course.
And I've talked about this before on the podcast, but like your muscles will probably adapt faster than anything. And the older you are, the slower they adapt. Your bone density can improve significantly with weight training, and just activity in general. But the ligaments and tendons, although they can get stronger, do so much slower.
Correct.
And so if you increase your physical activity and your muscles are adapting rapidly, those ligaments and tendons are not, they can adapt, but it's slow.
And they kind of adapt, not so much in the way that muscles do in terms of strengthening or hypertrophying, but they kind of change their structure, their orientation.
Exactly. The collagen, right?
Exactly. To kind of modify the way you're treating it, essentially. The issue is that the muscles hypertrophy quicker, and they tend to kind of tighten up as you're using them more. And so if you get more stiffness and tightness through the muscles, you're pulling on those ligamentous, tendinous insertions more.
Yeah.
And that's when you start to develop tendonitis. So Achilles, tennis elbow, shoulder, those are the things that, and then you got to work with physical therapy and things like that to really stretch the muscles out so that the tendons can have a little bit of relief.
And so the best way to kind of mitigate your risk of injury would be to kind of slowly increase your volume over time. If you're lifting, for sure, taking a deload week where you kind of go down every 5 or 6 weeks.
Yeah, of course.
Is kind of a good idea.
Similar process. So where you get out and you play, do some practice, then go, to the next day when you maybe play one game of pickleball, and then you go play 2 games of pickleball the following day. So rather than like going out and playing for 3 hours straight, where you're just cutting and pivoting and diving, swinging, you're going to pay for that. So I'm going to pay for that.
Ease into it, right?
Yeah, exactly.
Well, it seems like a really cool practice that you've created here, and I think being an athlete, I'm sure you love working with athletes, and then seeing them down the road do well too is very gratifying.
Yep.
Well, Devon, I want you to know we're very happy to have you here, and thanks for coming on the podcast today. I appreciate it.
Yeah, thanks for your time.
You bet.
Join us next time for Doc Discussions with Dr. Jason Edwards. It's medicine for your body, mind, and spirit.